Hello everyone. Today we are going to learn about the motor system examination. While examining the motor functions, you have to look for nutrition, the tone, power, muscle coordination, and the deep tendon, the superficial tendon reflexes. Anything in human lab is done under the following protocol that is abbreviated as WIPER. W stands for washing hands, I stands for instructing and introducing yourself to the patient, P stands for positioning of the patient, E is for the exposure, and R again is for the repositioning of the patient. The apparatus required is a knee hammer, a measuring tape in order to look for any muscle hypertrophy or wasting, and a hand sanitizer. While starting the motor system examination, you have to do it in two parts: the motor system examination of the upper limbs and the examination in the lower limbs. Both the examinations are to be first generally done in under the following headlines: the symmetry, muscle wasting or muscle hypertrophy, abnormal movements, and any deformity. While looking for the symmetry, you have to examine both the limbs at equal distances and at the same points at the same time. Look for any deformity, scar mark, claw hands, etc. Any abnormal movements. Right, so after the general examination, you begin with examining the tone of the subjects. Again, anything that you do in motor system examination has to be done on either sides of the on each sides of the limb. To check the tone is basically any kind of resistance that is felt at the joint by the examination while doing passive muscle movement. So while I am trying to examine any kind of resistance at the joint, I have to also compare it at the other side. So as you saw, I examined the wrist joint, the elbow joint and the shoulder joint on both the sides in order to check any kind of hypertonia. Hypertonia can be of two types, spastic or rigid. So that is examined and compared on both sides of the limb. From the tone, we move on to the checking of or examining the power of the upper limbs. This has to be done simultaneously on both the limbs. You have to first instruct the patient. आप अपने हाथ जो है दोनों ऐसे रखिएगा, ऐसे रखिए. आपको ये shoulders ऊपर की तरफ करने हैं, मैं रोकूंगा. You are looking for abduction. आपको अब नीचे की तरफ करने हैं. नहीं ऐसे ही रखिए. आप नीचे की तरफ करने हैं. You're looking for adduction, adductive power appears to be normal in this subject. आप दोनों हाथ अपने ऐसे करिए. You are now looking for extension at the elbow joint. आपको इधर देखने हैं अपने हाथ में, रोकूंगा. And now you're trying to look for flexion at the elbow joint. आपको अपनी तरफ हाथ खींचने हैं, मैं इधर खींचूंगा. ठीक है. This is how you look for the power. As I told you, it has to be done simultaneously on both the limbs, both the sides of the limbs. Now moving on to the coordinated movements. You have to do it one at a time. Starting with the right side, you have to again instruct the patient very carefully. This is known as the finger nose test for checking the coordinated movements in the upper limbs. आपको अपने नाक पे ये वाली उंगली रखनी है और ये वाली मेरी उंगली टच करनी है. जैसे जैसे मैं मूव करूँगा वैसे वैसे करनी है। फील करिए और तेज करिए और तेज करिए। ठीक है, अब उस हाथ से करिए सेम चीज़, नोज पे रखिए, तेज करिए। This is how you look for the coordinated movements of the upper limbs. Coming to the reflexes, you have to keep the upper limbs, the elbow joint at a semi-pronated position, and ask the patient to leave their hands passive or flabby. इसको बिल्कुल loose छोड़ दीजिए. We are going to begin with checking the biceps jerk. You have to locate the biceps tendon. Place your forefinger or your middle finger on the tendon and gently stroke with the pointed end of the knee hammer. इसको loose छोड़िए and look for the contraction at the biceps. Look for contraction at the biceps. The same is to be done on the opposite side of the limb. इसको लूज छोड़ दीजिए. This was to check the C5 root value, as C5 innervates the biceps. Again, coming to the brachioradialis, you have to gently stroke on the tendon at the medial aspect to check for the brachioradialis reflex. And finally, the tricep reflex, that is innervated by C6 and C7 root values. इसको बिल्कुल लूज छोड़ दीजिए. And you have to look for the reflex at the triceps. Look for the reflex at the triceps. The lower limb, again, when you're doing the motor system examination, you have to do it under the same headlines as you did in the upper limb. You have to check for nutrition, tone, power, coordination and the reflexes. One thing that I missed while doing the upper limb motor system examination was how to look for nutrition. You use a measuring tape and you fix a point on the upper limb and the lower limb as well. The points are to be same on both sides at equal distances from the measured point. For example, when you are trying to measure the nutrition of the arms, you are going to mark a point at the mid arm by measuring the distance from the acromion until a point that is suitable to you as the midpoint of the arm, around 135 mm. The same 135 mm is to be measured over here as well, and you are going to measure the mid-arm circumference, that is around 122. The same position here is going to be 122. So this is how you basically measure nutrition. You have to mark points on both upper limbs and lower limbs at the mid-arm position, at the mid-forearm position, at the mid-thigh position and at the mid-leg position. And you have to compare the sizes that you get on both the sides. This is for nutrition or the bulk of the muscle, and it is going to indicate if there is any anomaly either towards hypertrophy or towards muscle wasting. Right, so this was about nutrition. You also have to look for any kind of scar marks any kind of deformity, any kind of abnormal movement. The subject over here is not fully exposed, but you would rather prefer a subject that is exposed to above knee position. Any kind of abnormal movement, any kind of deformity is to be seen, and any scar mark is to be asked for from the patient. ये कैसे हुआ था भैया? जो पैर पे marks हैं? So you have to get a detailed history of how any kind of scar mark or any kind of deformity or any kind of lesion is present on both the upper and the lower limbs. Right, so this was about the general examination. Moving on to checking the tone in the lower limbs. Again, what is tone? Tone is the resistance that is felt at the joints when there is passive muscles of the movement, passive movements of the muscles. So you're trying to look for any hypertonia, any rigidity, any spasticity at the knee or the ankle joint. There has to be left and right movement, there has to be pulling movements. And this is how you look for tone in the lower limbs. Coming on to the power. The power in the lower limb is checked by asking the patient to raise the legs one at a time. इसको आप पूरी रेस करिए, ये वाला है, अब ये वाला है रेस करिए. The power grading will be told to you in the theory part. This is further examined by putting certain resistances when you are trying to. आप इसको इस वाले टाइम को रेस करिए, ठीक है, रेस करिए, ठीक है. मैं इसको उठाने की कोशिश करूँगा, आपको उठाना नहीं देगा, ठीक है. You're trying to look for the power at the knee joint, the hip flexors and the knee extensors. Again, the same on the opposite side. Now you're trying to look for the power of the knee extensors. आप इसको बाहर देखेंगे, मैं इसको रोकूंगा, ठीक है, इसको ठीक. For the knee flexors, for ankle dorsiflexion and toe extensions, you have to ask the patient to try to dorsiflex the toe part. मैं आपको ऐसे रेजिस्टेंस दूंगा, आपको अपनी तरफ खींचना है, ठीक है, अपनी तरफ खींचिए, हाँ, इधर भी करिए, ठीक है. Now looking for plantar flexion and toe extension, इधर देखिए, ठीक. This is how you look for power in the lower limbs at different points, at different joints. Coming on to the reflexes. You do a knee reflex, knee jerk reflex. इसको लूज छोड़िए, बिल्कुल लूज छोड़िए. Have to perform it on the other lower limb as well. इसको बिल्कुल लूज छोड़िए, एकदम और लूज छोड़िए. And the ankle reflex, लूज छोड़िए, एकदम लूज छोड़िए. Ankle reflex is examined better when there is proper exposure of the lower limbs. इसको लूज छोड़िए बिल्कुल, हाँ. And finally, the plantar reflex or the Babinski reflex, the normal reaction to this is the toe flexion and the other great toe flexion and the rest of the toe flexion as well. And finally, the coordinated movements. The counterpart of finger nose test in the lower limbs is the knee heel or the knee shin test, in which you ask the patient to move the heel of the other foot on the knee until the ankle joint of the other leg. ये आपको यहाँ रखना है नी पे और इसको ऐसे नी से मूव करना है. दूसरा वाला प्रेस. If there is any outward movement from the shin of the heels, it indicates cerebellar ataxia.